The joy that I get from working with people, sharing their joys and the exciting things that are going on in their families, it's just, to me, so fulfilling.
Jan, at St. Mark's Hospital, is a registered nurse in various departments.
She's been in the ER, she's been in the pain clinic, she's been in the senior clinic for several years. And so everybody knows that she's the one who has the answers.
She wants to work. She loves to help people. She's been through some really tough stuff, and she helps people also get through tough stuff.
My husband was an amazing man. Once he was diagnosed with cancer, it was time to break away from work. And so we started traveling every month out of the country between his chemotherapy. My husband passed away, it'll be 8 years in September, and I've kept going, so I've gotten around.
She kept traveling, and she still goes, and it's over 115 countries. It's not a vacation either. It's, let's go make something better for somebody who otherwise wouldn't have a chance.
It's so fulfilling to get to know these people, and as you get to know them, then you find out the needs that they have. I've been able to distribute shoes to children who've not had shoes before. I've been able to take computers to schools as well as medical clinics. I have organized medical supplies. The reception I get, that is the reward. That's what it's all about.
She has a great family, beautiful grandkids, beautiful children. But again, she gets on that plane and she goes to that third world country and she helps people because she knows otherwise somebody might not do it. She's traveling in plywood boats with no life jackets to an island off of Honduras. I mean, that's just amazing to me because it's putting everything else ahead of her.
She understands other cultures because she's visited them. She has interacted with the people. She knows exactly what to tell them. She knows how to comfort them. She knows what's going to make them feel better because she's done this before.
I think the experiences that she has gone through has allowed her to give perspective here to patients, to other colleagues, to staff members to say, listen, we're going to be okay at the end of the day.
Jan is one of the nicest people I know. She just has a big heart and she will do anything for anybody.
If I send her into a room or on a phone call, she is going to be kind and loving and compassionate.
I often tell people there's nobody I've ever met that wants to be in a hospital bed, but I guarantee if I ever found myself in that hospital bed that I want Jan taking care of me.
There's a quote from Dr. Frist that I just love. It's, be happy in your community, be active. There's so much good to do in this world and so many different ways to do it. There are lots of opportunities to serve, so get out there and do as Dr. Frist said.
I really think that we were made for service. I think it's where we find our greatest worth. I think it is why we live in community, is because we are supposed to serve together.
Dr. Scott's been here at Redmond for 16 years, very concerned about his patients, very attentive to his coworkers, a very generous person, a wonderful family man, a great community servant. I can't say enough good things about him.
Dr. Scott served on our credentials committee for 7 years. He is always going to think through the right thing to do, the most ethical thing to do. We were able to develop a very strong enhanced surgical recovery program really before it was a focus.
We've been able to put together an ERAS program facilitating a patient's throughput through a surgical experience. And the way we accomplish that is by breaking down silos.
Ryland is very aware of others. Unfortunately, there are far more children in Floyd County in need of foster care than there are parents willing to step up and provide those services. So Dr. Scott and his wife Jennifer became foster parents. And now over the years since they've done that, they fostered 8 children.
Seeing Dr. Scott in the community with his family has been not anything short of inspiring. Dr. Scott has been involved with Restoration Rome, a fantastic organization that has really brought together the resources in this community like none other.
Restoration Rome is really the result of massive collaboration between public, private, and faith-based partners for foster care. Ever since I've known Rylan, he's had a heart for kids and doing whatever he can in this community.
I was talking through some of this with my wife. She said, you know, when I hear you talk about ERAS, you're basically talking about restoration room. With ERAS, what we look to do is shorten the length of stay, minimize the pain, enhance the recovery, get them back on their feet again. The restoration room, it's the same thing. We're taking broken, damaged families, and we bring together a bunch of resources to restore their family and get back on with their life.
I see in Dr. Scott exactly what I think probably existed in Dr. Frist Sr., that humanitarian instinct, that determination to do what he can to improve the lives of others.
If you value the individuals you interact with on a daily basis, then service should just flow from that. I don't think of it as giving of myself toward service. It is rewarding for me to be able to serve.
Everything you get involved in life teaches you a lesson on how to lead your life better.
Sharla's been at Eastside Medical Center almost a decade now and really provided tremendous service and care for our patients as she leads our volunteer services.
She's a go-getter. She's not afraid to try new things. She's very creative. Sharla is involved in a lot of different aspects of the hospital, from the NICU. She was a president of the auxiliary. She is involved in our volunteering program. Even outside of the hospital, she's involved in domestic violence group therapy sessions. She's involved in the state youth council and youth camp program. She still is a substitute teacher at many of the schools in the area too. It's just truly astounding.
We have a very challenging population when it comes to prenatal care. When they just need a little cuddle to feel better, her and her volunteers are there for them.
The babies that we cuddle here at Eastside are usually the product of methamphetamine, drugs, and maybe this is the one chance that a baby feels the warmth of someone holding them.
We actually have a tab raising that happens every year that the auxiliary puts on. Sharla is the spearhead of that, and behind that, we gather thousands and thousands and thousands of tabs to help additionally raise funds for the Ronald McDonald House and help to support those families that have children in the hospital.
We take our high-achieving students in the surrounding high schools. Sharla is the coordinator of that, and they are here for 8 weeks throughout the summer. Most of them are aspiring healthcare professionals.
I know, being a mother myself and raising my sons, that you still have an influence on that age group. A lot of people don't think it. This shows the adults here in the hospital that teenagers are really great kids. I wrote a youth scholarship. We had 21 applicants and handed out 10 $500 scholarships to students all over the state of Georgia.
We see her daily and her impact on our volunteers, on our patients, on our employees, on our visitors. Good people beget good people, and for her, she lives that mission and that motto every day, and she just really represents what we're all about.
I can think back to years ago when my father was dying from cancer, to see how that hospice volunteer was there constantly. She was there along with the hospice nurse the moment he died. And both of them held me tightly. And I thought, this is what volunteering is about. This is what I want to do for other people. To be a volunteer, it means giving of your time, your talents, and your heart. I'm just so proud of being a volunteer here at Eastside Medical Center.